Join us August 21st for this month's Lunch and Learn with the Link, focusing on chronic GVHD of the skin. Our guests will be Dr. Rachel Rosenstein of the Hackensack Meridian School of Medicine and Ann Fitzpatrick, an MDS survivor. This free webinar will be Wednesday, August 21st at noon Eastern. To register, visit nbmtlink.org or follow the link in our show notes. Welcome to Season 14 of the Marrow Masters podcast, brought to you by the National Bone Marrow Transplant Link and sponsored by Insight and Syndax. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow and stem cell transplant, from diagnosis through survivorship. This season focuses on chronic graft-versus-host disease, or GVHD. We'll cover male and female sexuality, the emotional struggles of the disease, and even atypical presentations of GVHD from the perspectives of patients, caregivers, and medical professionals. Here's your host, Executive Director of the NBMT Link, Peggy Burkhardt.
Hi, everyone. Today we welcome Dr. Doris Ponce of Memorial Sloan Kettering Cancer Center. So Dr. Ponce is an associate member, co-chair of the Center for Hematologic Malignancies and director of the Graft-Versus-Host Disease Program at MSK. Today, she's going to help us out with a bit of a different spin on chronic graft-versus-host disease. We're going to cover atypical presentations of GVHD.
Thank you so much, Peggy, for the nice introduction. And thank you so much for having me. I am thrilled to be able to connect through this platform to answer any questions or things that come up with my own patients and hopefully add a little bit of that information here.
Terrific. So let's jump in on exactly what you will discuss today and why it's so important.
As we know, graft-versus-host disease can wear many different hats, and patient can have different kind of symptoms that can be attributed to other things, or sometimes we don't know if it's graft-versus-host disease until at some point is more developed. And some patients might have their own conceptions of what their symptoms are related about. Oh, this is related because I felt too hot, too cold, the food, or other things that might not pinpoint asking for help with their clinician. So I think it's important just to understand that while graft-versus-host disease has been very clearly delineated through guidelines that we use in clinic, there are other symptoms that could be present that are also like allo-mediated, like comes from the donor cells. And also, as part of the conversation we want to have, there are a lot of questions that come up in clinic about what to do, what their like daily routines and other things. And not everyone knows the answer for it, like their regular clinician. So I think it's interesting if we go over those things as well, just to try to help some of our patients with their questions.
Why don't we talk about the organs that are affected?
Right. So as we know from the National Institute of Health, we do have clear guidelines about which organs are affected with graft-versus-host disease. And it goes like top to bottom, like from the skin, mouth, eyes, musculoskeletal, GU, and lungs as well, and liver. So we have a total of 8 organs that are part of the diagnostic features and a presentation of graft-versus-host disease. But what we want to touch base here is what we call atypical presentation. Actually, the NIH also acknowledged that there are some manifestations that are not the typical out of those 8 organs that are being clearly described that could be part of graft-versus-host disease. And what it means is that graft-versus-host disease is a donor-mediated reaction against the host, which is the patient. And that allo-mediated reaction can also present in what we call atypical or not like common manifestations, not very common, but it could be mediated from those donor cells. So some of the organs that can be affected could be the kidneys, it could be the nervous system, muscles, heart, pancreas, and they can present in different ways from what is typically described. Like, for example, patients can have symptoms of serositis, effusions like pleural effusion, pericardial effusion that could be treated with like anti-inflammatory. We also have manifestations like nephrotic syndromes, other autoimmune disease like loss of pigment in your skin. Those can be manifestations that are triggered or mediated through the donor cells or the donor immunity.
So these presentations, they are rare, correct?
Yes, correct. So one of the hallmark here is the atypical presentations are rare and are usually diagnosis of exclusion. So you need to make sure you're not missing any other relevant diagnosis here. And part of your differential could be other diseases, other complications, let's say drug side effects, or other potential culprits, infections, like all of that should be considered before really providing the diagnosis that this is atypical graft-versus-host disease, being a rare manifestation as part of your clinical condition.
Let me ask you, do most of these diagnoses come from, I'm guessing, sometimes the primary care physician back when they're home, or do you encourage your patients to call the center the minute they don't know? How does that work with your center?
This is a great question. It could come different ways. So either the primary physician can identify some of these clinical symptoms that are atypical. It could box them into like a non-GVHD symptom, like for example, serositis, myasthenia gravis. And so we'll belong to that clinical umbrella diagnosis, but not necessarily related to the donor allo condition, but more into like an autoimmune separate disorder. So sometimes we see that, other times the patient can reach out and provide some symptoms that are different or new, and they might not consider that there is any connection with their transplant, but they could bring it up. Another thing is that we have at our institution a graft-versus-host disease clinic, and I have patients coming with sometimes symptoms that are extremely rare that nobody can really tease out from their community what is going on. In many of these cases, we're trying to figure out what is the diagnosis. It is indeed graft-versus-host disease. So it could come from different territories, but I think the main message here is that it's usually not as straightforward, but it goes into different pots of potential of other possibilities until we reach out the diagnosis of GVH.
Okay. Dr. Ponce, let's talk about atypical skin-related GVHD, because that is by far one of the biggest things that we get questions about.
Right. So when we say atypical, if you go into the NIH criteria, you will see that skin is being well described into particular changes in how the skin appears, including what we call sclerodermitis, which is when the skin is very tight. So those are pretty straightforward and we see them in clinic. However, sometimes patients can have other type of skin lesions, like for example, loss of pigmentation or vitiligo. Other patients can have like severe dryness or cirrhosis with desquamation. Also, the appearance looks like a fish skin texture, very dry, and either like changes in their scalp or changes like it can look like psoriasis as well. So those don't typically belong to what we call diagnostic criteria or like the typical symptoms, but are more into atypical presentation. So those are the ones that we're talking about. And how you treat, it depends on what kind of symptoms the patient have, because it could vary from different ends. But many times the use of steroids comes handy, or immune suppression. So sometimes we recommend topical steroids or other topical immune suppression, like for example, tacrolimus is being used for certain lesions in the skin. Or like, for example, for the scalp, we have used shampoos with steroids as part of how we treat. But it all depends on how the patient present. Like we had a patient with vitiligo using topicals and also like light therapy. So it could be really scaled to the patient and customized depending on how they present.
Very good. What about showering tips in regards to the skin?
Okay. What we recommend is if you have graft-versus-host disease, and not necessarily only a typical manifestation, but if you have graft-versus-host disease affection, we recommend to try to avoid daily showers just because we produce natural oil, and in graft-versus-host disease, the skin tends to get drier. And if you shower very frequently, is more common to get drier. So recommendation will be like short and using lukewarm water. So short showers of less than 20 minutes is ideal. Avoiding very hot water is also ideal because extreme hot water can make you feel itchy. So that could be a good way to do it. You could shower daily if you prefer, but if you do that, just try to do it very short, like brief, not like a long bath, just because of that natural oil that you will lose if you do very frequent.
No, it's funny. I was just thinking when you were saying that for some people, that's how they get their day started. The rinse off, just to go do a rinse off. So you're in and out and you just feel better. So I think these are great tips, especially about the lukewarm water. So ingredients in skincare products that should be avoided.
There are a lot of things. We just have to pay attention to the label. So one of the things we want to avoid is alcohol content in some of those ingredients. Products that are exfoliating tends to be very abrasive to the skin. So we also want to avoid that. We also recommend avoiding like fragrance type of products because those can also be more abrasive. So we want it to be gentle, fragrance-free, that will avoid like being too harsh to the skin. There are products that have retinoid, alpha hydroxy acid, like some of them, like just think about products like for acne, for example, those are too abrasive for the skin. So more into the mild, fragrance-free, gentle, ideally will be the one to recommend.
Sounds good. And what about the sun? Oh, we all love the feel of the sun on our face, but tell us more about that.
Right. So sun can sometimes bring up some rashes and make them angrier. So we want to avoid being exposed to the sun directly. So what we recommend is that you can spend your time outdoors, but try to use sunscreen protection and ideally with SPF 30 or higher. And then remember to retry the sunscreen. Also, now the sunscreen comes with dual UVA and UVB protection. So just make sure you have both. It is important to include both because there are different bands of light that can affect your skin. So it's important to have what we call broad spectrum sunscreen. There are also clothes that comes with ultraviolet protection factor, or it's called UPF. And for that, you can make sure the clothing, like you can wear a hat to cover the back of your neck is another area that could be sensitive with skin. And you can use your clothing just to cover yourself, like a shirt or long sleeve. Or if you don't prefer a different one, you can also buy any one you want that is like light, like cotton sleeve, for example, and try to avoid like the peak hours of the sun, like between 11 and 3 p.m., where those sun rays are the strongest.
Well, and that's something we should all be doing, right?
Yeah.
We had a survivor recommend several lines of clothing for this, and we'll be sure to link them in the show notes.
And another thing I want to bring up is that there are two types of sunscreen, just to bring it up. One is called the chemical sunscreen. The other one is the mineral. So the chemical sunscreen is the one that usually spreads easier. Like usually you can spray it on your skin. That one has some of the ingredients is oxybenzone or avobenzone. And those sunscreen are great for like, they could be waterproof and they're great just to include your whole body, like in a very quick application. The only thing is that if you have sensitive skin, it might irritate your skin. And the other option that could be better for sensitive skin is the mineral sunscreen. And think about those are like very thick one, like those are made of a base of zinc or titanium dioxide. So those are the thicker one that you need to rub under your skin. Those are better choice for you have sensitive skin. You just have to be patient to make sure you include your whole surface when you're putting it in.
And that zinc takes a while to get in, that's for sure. But you are the most protected, I'm guessing, because it takes a little bit longer.
Right. For example, or sometimes what you can do, like you can use like your face and the back of your neck with the mineral sunscreen and maybe apply the rest. Or if your skin is less sensitive in other areas, you can use both. But definitely having mineral sunscreen, it penetrates your skin and it can help with that sensitivity if you're sensitive.
Oh, that's good to know. Thank you for that. So Dr. Ponce, let's talk about makeup. We have many patients who want to wear makeup. What are the rules on that?
Well, I have to say for any patient who wants to wear makeup, the answer is that you can. Actually, I love this topic because I think it's important that patients feel confident and comfortable with their appearance and how they look. And sometimes graft-versus-host disease can take away that. And makeup can improve how you look, or if you feel that some skin changes are not what your desire is, makeup can definitely be an ally to help to improve that. We have provided some guidelines about what to do or tips of which products to use or not, but any patient can wear makeup at any time during their journey after transplant. But now, what kind of makeup? So following a little bit of the rules for what kind of products to use for the skin in general, like when you're taking a shower, it also applies for the makeup, where we recommend just do a mild, gentle, fragrance-free. There are products made for sensitive skin. Those are the ideal one that you can pick. Also, we recommend to avoid products that have several ingredients. So 10 ingredients or less is the way to go. And also, if you have graft-versus-host disease, we recommend using a new product at a time, not like multiple, because if you were to have a reaction to them or it's irritating, you don't know where it's coming from. So it's better to use like one at a time, try it on. If it feels well, then you can move on and add a second one or a third one. Another thing is just to be careful is that products labeled as organic or unpreserved can actually have germs. So we don't recommend those like natural organic makeup because of the risk of infection. There are other products that come with some like plant-based ingredients like arnica, eucalyptus, ginseng, menthol. Those are really harsh to the skin, like the botanical ingredients. And others that have powder can also be products that could be very irritating to the skin and should be avoided. And parabens is another one that is very common in makeup. So you have to pay attention to try to avoid those also because it can make your skin more sensitive. And the other like tip is that just to remember that makeup should be replaced at a certain time point. So for example, if you have a foundation, you shouldn't keep it for longer than a year and a half. Eyeshadows, about a year. Like lipsticks, no more than 2 years. So just to remember, clean your brushes and replace your makeup every so on, just to make sure it doesn't go contaminated with time. And finally, there are for patients that have like changes to skin that they want to really cover. Like if you use one of those concealers to cover the skin, like the spots, it's something that you could definitely do as long as your skin is not broken.
Well, and I'm thinking to myself, I'm thinking of some of the makeup I have. I better keeping that in mind as far as the expirations go.
Yeah, that's something that when I was preparing for the podcast, you're thinking about tips. I was like, oh my God, I also need to go through my makeup and replace some of the things that I have.
Dr. Ponce, there is a program that I want to mention. Jennifer Gillette, our staff social worker, had shared with me that there's a program by the American Cancer Society called Look Good, Feel Better. This wonderful program talks about disposable mascara wands, for example. Instead of double dipping, if you're worried about an eye infection. I just didn't even know that they had sites like this. So I just wanted to mention that. We'll put it in the show notes because what we're trying to do here is just make sure everyone can feel as good, just like the name of the program that the American Cancer Society puts on at whatever stage they are in their treatment.
I absolutely agree. Graft-versus-host disease can take a lot from you. And coming back and being strong, healthy, it does fulfill you as a person, including how you look and how you feel is really important. We have seen patients that other aspect of getting better is really a journey that it not only includes the medications for the treatment of their malignancy or their cancer, but also how they eat, what exercise they do, and how they take care of themselves is so important. So I think what we're talking here is really relevant, and especially learning about these organizations that want to support that journey is extraordinary.
I agree. So let's talk about hair now. We know that this is so important to so many of us, and I could imagine many patients lose their hair and then they get it back and they're excited and they want to make the most of it. Any tips on hair care?
Right. So hair loss is universal when you go to transplant. And then we always say, it will come back. But sometimes when the hair comes back, comes in a different texture or feels different. So, some of the expectation is that it might be different when it comes back. But also when you have graft-versus-host disease, you might start experiencing hair loss. And this could be, I think, that we could address during clinic. There are ways or treatment that we could apply to the scalp that can help hair regrowth. So it's important to bring it up. If you are starting noticing losing your hair, bring it out to your clinician. Sometimes with topical treatment is enough. Sometimes you need more than that if you have other organs affected by graft-versus-host disease, but definitely inflammation can affect your hair. Some of the questions that I get frequently is, can I wash my hair? Can I use a wig? Or what kind of products to use? So yes, you can brush your hair. We recommend something around every 2 to 4 days. And also because we produce natural oils, and washing your hair every day can make it really dry. If your routine includes washing your hair every day, I strongly recommend to try to skip a day or so if possible, just because of that natural oil loss and your scalp being too irritated. In terms of what products to use, so there are, again, like products that are mild or like gentle to the scalp. There is a product that you can use for dry hair that is great, like co-wash is one of them. It's one of the products that is being created for dry hair that can be used for this kind of situation where with graft-versus-host disease or after transplant, you decrease that natural oil production, and that could really help.
Mm-hmm.
And other things that could be considered is like there are some like biotin supplements that can be used. You can take it by mouth, and even some products can bring it to hair. And sometimes we recommend like topical minoxidil that has been marketed for male hair loss, natural hair loss. It could also be used in graft-versus-host disease, but I do recommend like checking with your clinician, making sure that that's something that they can use.
Very good. And what about wigs?
Yeah, wigs can be used, but there are different type of wigs. And as long as the wig is something like you can put on, it's fine. But there are wigs that has to be glue on. Those I will recommend to avoid because the glue can be quite irritating to the scalp and also can cause permanent scarring that it will prevent for hair regrowth in the future. So you might be causing like permanent damage if you use the glue one. So something that you clip on is fine. You can use natural hair or you can use synthetic hair. It really doesn't matter. Sometimes the synthetic hair is like easier to handle or manage to the style that you want. So it could go either way. Like you don't need to spend thousands of dollars on wig. And also patients might prefer not wearing a wig and like we use beautiful scarf. That's also an option that patients can use. But it's just to remind, like just not to glue anything on your scalp. It's important when selecting a wig.
Oh, this is terrific. Thank you.
I also want to add dyeing your hair. I just want to mention that it's okay that you can use any of the dyeing hair products. We just recommend to avoid the ones that have ammonia. So there are a lot of products that are ammonia free, and those are fine. You can use it.
And last, maybe we'll talk about nails. Any thoughts on nail care?
Right. And nails can be brittle after transplant and during the graft-versus-host disease journey as well. So some of the things that we recommend is using nail hardener. So like Sally Hansen has one, and there are other brands that have those nail hardening. Those can really help to strengthen your nails. And then you can put on your color if you want, just to, follow the instruction from the bottle. The acrylic nails, I recommend to avoid those just because when your nails are brittle, applying acrylic can be too harsh to the natural nail. So it's better just to put nail hardener with color on top and then just wait for the nail to grow out. It takes about 3 to 6 months to get your whole nail. So after transplant, it's common to have brittle nails, and then after day 100 will start getting better because of the cycle of the nail growth. And another thing just to highlight that treatment for graft-versus-host disease can also contribute to improvement in the nail appearance. And Sometimes there are other issues that can affect your nails, like, for example, vitamin B12 deficiency can be one of them. So it's important to bring that up to your clinician as well, just to make sure that there is something that can be treated to be addressed.
Oh, thank you. So as we wrap things up, Dr. Ponce, any final words for us today?
Well, I want to thank you for allowing me to share some of these comments with our patients. Journey after transplant has many different players. So when I see a patient and we think about our patients, we think as a whole. So it's not only treating their cancer, but again, it's just taking care as a whole person, human being, how you feel and how you come back stronger. So I think what we have our conversation today is how to contribute to that journey to get our patients better. I have patients coming to clinic who didn't feel well, like medically didn't feel well. And you can see the transformation as they go through treatment and getting better, how they change in appearance, in their activities, in their mental health, and how they move through this journey. So I think it's important, one, to don't think that any symptom is something silly, but it's important to bring it up to the clinician because there could be ways or tools that we could provide to patients to make them feel better. And then the other thing is to remember to take care of yourself. And I always, when I see my patients that start wearing makeup and like taking care of their appearance, I know that they're feeling better. That's usually a good sign when you start thinking about how you look and how you feel. So I always feel encouraged when I see that part of them because I know like, oh, you come to that point where you feel that you get back to your normal and move on with life.
Oh, I love that. And it is so true. When you see somebody that feels good about themselves again, you know that they're doing well mentally as well. And I'm sure as a doctor, I can see that being very rewarding. Well, we are so happy to have had you here today. Thank you for your time and all that you do for patients. You are a very special doctor, and I so appreciate the chance to talk to you.
Thank you so much, Peggy, and thank you for your kind invitation to share some of these thoughts today. And I hope we can contribute to our community with having amazing patients.
This has been the Marrow Masters podcast. If you know someone who would benefit from the information in our show, please share this episode with them. And don't miss future episodes of our show. Follow Marrow Masters for free on Apple Podcasts, Spotify, YouTube, or wherever you're listening right now. And to connect with the National Bone Marrow Transplant Link, visit nbmtlink.org or tap the link in our show notes.